Welcome to Dr. Balga's podcast for the Curious Doc. Today is February 18, 2026. This video is on a Lancet article published 4 days ago on Feb 14th, titled Efficacy and Safety of Minocycline in Patients with Acute Ischemic Stroke. The acronym of the trial is the EMPhaSIS study. It's a multi-center, double-blind, randomized controlled trial. There was an accompanying a comment in the Lancet titled Continued Hope for Late Neuroprotection with Minocycline. Minocycline is a tetracycline antibiotic with anti-neuroinflammatory properties, targeting microglial activation, matrix metalloproteinases, and blood-brain barrier integrity. This was a multi-center, double-blind, placebo-controlled, randomized trial across 58 countries in China. The study cohort comprised of 1,724 acute ischemic stroke patients within 72 hours. The NIH stroke score was between 4 and 25. The 200 milligrams of a loading dose of minocycline was given, and 100 milligrams every 12 hours for 4 days, and this was compared versus placebo. The primary outcome was a modified Rankin score of 0 to 1 in 90 days. The median age of the cohort was 65, 67% were male. The median NIH stroke score was 5, and the median onset to treatment was as late as 41 hours. Statistical model, mixed effects generalized linear model. An alpha of 0.05 was considered significant. What were the results? What did they find? The modified Rankin score of 0 to 1 in 90 days was 52.6% in the treated group versus 47.4% in the placebo group, p-value 0.0061. The ordinal shift, the common odds ratio was 1.19, p-value 0.018. Secondary outcomes, the NIH stroke score change at 6 days was the beta of minus 0.28, p-value 0.015. Modified Rankin score of 0 to 2, p-value 0.0056. There was no difference in stroke recurrence, p-value 0.68. Safety, there was no increase in symptomatic intracranial hemorrhage or serious adverse events. Limitation of the study, all Chinese population. The strokes were mild. The upper age was 80. And the sensitivity was to the worst case imputation. The key takeaway of this Lancet study, short course of minocycline within 72 hours improved 90-day functional outcomes without a safety signal. What did the accompanying commentary say? The author says neuroprotection should be reframed as cytoprotection of the neurovascular unit. He expressed concern that the randomization occurred late, median was 41 hours, and the stroke severity was mild. The absolute risk difference was only 5.2% for a modified Rankin score of 0 to 1. The result was sensitive to extreme imputation assumptions. There was no strong subgroup consistency. He called for future studies with imaging biomarkers, blood biomarkers, and replication trials. So, in his opinion, minocycline is attractive, inexpensive, generic, and widely available, so should be evaluated further. Clinical pause. Anti-inflammatory targeting after stroke remains biologically plausible. Benefit observed despite modest NIH stroke score change. It's safe with reperfusion therapy. Potential greater effect in large artery and small vessel disease. It's cheap. It's an oral preparation and scalable therapy if these findings can be replicated. These are some acronyms related to this study. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.